that spread.
As the number of 911 calls from people experiencing COVID-19 symptoms continues to grow, paramedics are only taking patients in serious condition to the hospital. MedStar crews in Tarrant County are directing the others to stay at home and seek care from their primary physician instead. Our Caroline Vandergriff looks at how the process helps those lessen the strain on area hospitals.
Right now, MedStar is seeing more COVID-19 related calls than during the peak of the pandemic. Paramedics are screening about 130 patients a day for the virus. That's up 165% from where it was in June this year. MedStar is urging people to really evaluate their symptoms before calling 911. Patients with minor complaints like a mild fever, some nausea or vomiting, or a slight headache will likely get a slower response time as paramedics focus on higher priority calls. And once crews assess them, if their vital signs are good, they won't be transported to the hospital, even if they want to go. MedStar is currently implementing this protocol on about 8 patients per day, as North Texas hospitals struggle with capacity.
It doesn't make any sense to bring those patients to an already crowded emergency department when their care can easily be managed in a more appropriate setting. And it's one of the ways that we're helping to reduce the number of patients that are going to the emergency room.
EMTs and paramedics give educational material to those patients with minor symptoms and ask them to follow up with their doctor or an urgent care clinic for COVID testing and treatment. MedStar doesn't want people to hesitate to call 911 if there's a true emergency or they're experiencing serious symptoms like difficulty breathing, severe headache, and chest pain. Paramedics will always respond no matter what the call is. In Fort Worth, I'm Caroline Vandergriff, CBS 11 News.